Welcome to today's podcast, where we dive into the world of upper lid blepharoplasties. We're thrilled to have with us consultant plastic surgeon Mr. James Smith. Mr. Smith is based in Yorkshire, working for the NHS at Leeds General Infirmary and privately at Coppergate Clinic in York. In this episode, we'll learn everything you need to know about upper lid blepharoplasties. We'll discuss what the procedure entails, how the consultation process works, and what actually happens on the day of the operation. Mr. Smith will also share valuable insights on how to find a reputable plastic surgeon in the UK for this procedure. Whether you're considering having an upper lid blepharoplasty yourself or simply want to learn more about this fascinating area of plastic surgery, this podcast is packed with expert advice and practical information. Let's get started. So today we're going to be talking to Mr. Smith about upper lid blepharoplasties. So can we start by explaining what actually is that?
Yeah, so an upper lid blepharoplasty is essentially a skin reducing procedure from the upper lid. We kind of describe it as a bit like a rejuvenation type procedure, but the idea being that you're taking off some of this excess that people have on their upper lid.
Okay. And can you talk about what type of person would benefit from this operation?
Yeah, so realistically, most people who are coming in are complaining about either having excess skin there, or they're having hooding when it's coming over, or they feel like their lids are very heavy, or people are complaining that they look tired, things like that. So usually it's dealing with trying to do with the skin, plus or minus little fat bulges that you can get in the corner as well. Now, a lot of our patients say this is a familial thing, and they say, "Oh, my mum or dad had it, and I don't want to go in that direction." But yeah, certainly we often end up operating on many members of the same family. So it is a genetic thing that sadly is passed down. There's obviously worse things to pass down, but this is one thing that does get passed down.
And what kind of age range do you operate on?
Yeah, so probably at the earliest is early 30s, but usually 30s, 40s, 50s and upwards. We tend to, the most common I'd probably say is between 40s and 50s. I guess the issue with the 30s is they may have excess skin. Absolutely, as I said, it can be a congenital or a genetic type thing, and people do lose their elasticity in their skin. But realistically, the earlier that you do it, the more likely they are to need to have it done again. And you just need to let people know that and not trick them into thinking this is a one-off procedure. So really you want to get it done at the time of your life that's going to give you the maximum benefit without the potential need to have it again. So yeah, usually 40s or 50s is a great age.
So what sort of thing happens in a consultation? Can you run through what you would do?
Yeah, so normally, for the upper lid blepharoplasties, we either do face-to-face consultations or we do virtual. Virtual consultations actually work very, very well. So either with FaceTime or WhatsApp video or Zoom. I quite like Zoom just because you can draw pictures, despite the fact that quite a lot of our patients seem to have escaped COVID without using Zoom, so can't use it. But if you can't, it's fine. Telephone video calls is fine. And then obviously we go through everything in more detail where we see people face to face. But realistically, what we try and do is ask what their concerns are, what they want to try and address. We ask about any other alternative treatments that they may have had or may have considered, whether they've had things like Botox.
Yeah.
Because that influences brow position, or at least can potentially influence brow position. So we like patients to have been at the end of their Botox when they come and have their upper lid blepharoplasty. So usually about 3 months after their last dose of Botox. And really the reason for that is, as I said, brow position is really, really important. Females tend to have much higher brows than men. Male brows tend to sit much lower, but you can see on me, I don't have any excess upper lid skin, but my brow sits so low that it looks like it's clipping and holding over, and that's brow skin. It's not upper lid skin. So it's making sure patients know the difference and whether some form of brow lift procedure would be better for them than anything else.
Yeah.
And then really the other thing that we talk about is any contraindications, so any reason that they wouldn't be a suitable candidate, whether that be something to do with their eye anatomy or a comorbidity. So have they got anything else that's more significant that, you know, would just not be safe to do a cosmetic procedure on them? And then obviously then we talk through what the surgery entails
Yeah.
and what happens on the day of surgery and aftercare, along with all the complications and things as well.
So can you talk us through like what happens in the operation?
Yeah, so what we tend to do is we get patients in on the day. So it's a day case procedure, in and out in the day, and it takes about 90 minutes, the whole procedure. It's done under local anaesthetic. And what we do, we get you in, we talk through what we're going to do, you know, before we take patients upstairs into theatre, go through the consent form, get photographs done. And then what we do is we get you upstairs and we give everything a good clean, and then we mark up with a pen how much excess skin you've got. Now, realistically, there's quite safe universal markings that most surgeons use, but what we're trying to elicit is how much skin you've got compared to another person, because everyone's lids are very, very different. And realistically, what we're trying to mark is where the new crease is going to sit and then how much skin we can remove. So we mark up how much there is. And then what we do is what's called a pinch test. So we're pinching the skin together. And when we pinch the skin together, what we want to see is that the eyelid just about opens up and the brow doesn't get pulled down. Now, obviously, people worry that, you know, they've seen things on the internet where people have not been able to close their eyes at the end of the procedure. That's not something that we tend to see very much, fortunately, in this country as a life, you know, as a permanent thing. To be honest, when you leave the theatre, they will just about be open. That's quite common, but that's to do with swelling. But having an eyelid that can't close is something that people obviously want to avoid. But the other thing is pulling the brow down. Actually, if you take too much skin away, you can end up pulling the brow down as well. So that's why this part of the marking is really important. You know, it's arguably one of the most important steps in the whole procedure.
Yeah.
Once we've done that, what we then do is we put the local anaesthetic in, and essentially that's an injection just underneath the skin. So it's on the outside, just underneath the lid, and it goes right underneath the skin. So it's not near your eye. Obviously, it's quite close, but nothing's going in your eye. There's no drops or anything. There's no local anaesthetic itself going in your eye. But the injection itself takes about 5 or 10 seconds or so. And what we tend to do in Coppergate is have someone holding your hand because it is a bit stingy and we're trying to use as many distraction techniques. Now, people always ask how sore it is. Everyone is very, very different. People can tolerate much more, you know, different levels of pain. But you know, we tend to warn people it is a sore injection for about 10 seconds or so. I always tend to say to patients, you know, you are in a self-selecting group if you're coming to have it done. You're already pretty stoical because you've made the step to come and have cosmetic surgery. And then to be fair, quite a lot of our cosmetic patients have had other things done, so they're at least maybe used to having some form of injections. But we do try and warn people as much as we can how sore it is. And then essentially what we do is we then anaesthetize, we make it all nice and numb. And people always ask, you know, how do you know it's numb before you start? And what I tend to do is a little top-up injection just before we start. And that's giving me an idea of whether they can feel it or not. Because it's a very quick acting anaesthetic. But even with a quick acting anaesthetic, you just want to give it time to work before you do anything else, before you start.
So do you do one full eye and then the other eye?
Yeah, so I tend to I do the right eye first. So I'd put the local anaesthetic in and complete the whole of the right eye before I then move on to the left eye. And I do that for a number of reasons. Really, I don't like change, so I've always done it like that. So I don't really like doing it any other way. But the main reason I do it for local anaesthetic is actually it's a short-acting anaesthetic that wears off relatively quickly. And so some patients, by the time you're leaving theatre, saying, "Oh, I can start to feel it now." So, you know, if I put both eyes at the same time, there is a small chance in some patients they might start to feel it in that left eye before I've even started. But also the other reason I do it is just because as you're putting the anaesthetic in, it is a volume of fluid, so it causes a bit of swelling. And so I'd rather not cause swelling for that sort of 20 minutes before I've then gone to operate. But some of these things are a personal choice. I've got colleagues who do both eyes, and they say, well, it's nicer because you get it out of the way. So I completely get that. But I just do mine for a logical reason, and it tends to work for me, and I like it. So I do one eye and then do the other eye.
And then what happens with the stitches? So
I take the skin out to start off with.
yeah,
So we cut the skin away.
yeah,
Then we tend to take out a little strip of muscle, mainly because the muscle is providing a little bit of the bulk, but also it gives us access to fat pads. And some patients have a little bulge in the corner, and you can take out some little bits of fat. If you have the fat to take away, it's called your medial fat pad. We take it out. If you don't have it, we don't take it out. But it gives us access to that. We then use a little cautery device just to try and stop any of the bleeding vessels, just to try and reduce down the amount of bruising that patients get. And I say it now because a lot of people ask, can you smell it or can you feel it? No, it's not that kind of device. It's a very sensitive little tiny bipolar device that just cauterizes teeny tiny areas. So the patients don't even really know that you're doing it. You just hear a little noise as you're doing it. And then what happens is once we're happy that there's no bleeding, we then pass a stitch from the nose side of the wound, and it goes underneath the skin, goes back and forth, and then comes out the other side. And then we put steri strips over the top.
Can you see the stitches?
Once you've got the steri strips over the top, no. So what happens is you have the steri strips that go over the top, and then there's a little end that's left out here. Now, when you look up on the internet, you'll see some people leave stitch ends here and some people leave stitch ends here. Again, it's a personal choice, but I tend to leave a small amount of length here with steri strips over the top and a longer bit out the side, so there's something then to take it out, because it's a non-absorbable suture, meaning it needs to come out.
No.
And the reason we do that, because people ask, can I use an absorbable suture? But I use a lot of absorbable sutures, so stitches that degrade, disappear on their own.
Yeah.
But in order for a stitch to degrade, there has to be some form of an inflammatory reaction for it to disappear. And even the ones that disappear very, very quickly, so Vicryl Rapide, for instance, that still can take a week, 10 days, even 2 weeks or so for it to disappear. And we are trying to give you the absolute prime, stitch, and scar that you possibly can get. So in order to do that, it's a small stitch that gets taken out as early as it can, and then it's a running stitch underneath. And then it avoids the little tiny marks potentially that you could get. Because I tend to say to patients, if I say, well, draw me a scar, most people are drawn up and down with lines across, and you get the lines across, and because you've either put intermittent stitches or staples, for example, and they've been left in for a bit longer than you'd expect to leave them in 10 days, 14 days. So we're doing a stitch underneath, so that then there's no evidence that stitch has then been there. Essentially.
Okay, so it's almost like a hidden stitch. What's the real name for it?
Well, it's a running stitch, and it's a subcutaneous stitch. So it's just underneath the skin, essentially.
Okay,
And as I said, it's a non-absorbable.
And so other surgeons might do it in different ways, but this is how you do it.
Absolutely, yeah, absolutely. I do it, I do it for those reasons, but people do things in different ways, and there's not always an absolute way to do something. But I do it for this reason. It makes scientific sense to do it like that, I think, rather than using the absorbable sutures or the intermittent sutures, for instance. But some of these things, as I said, is a personal choice, but I think it makes sense as to why we do what we do.
And then you put the steri strips over the top of the stitches, so you won't see them.
Yeah, steri strips. So I tend to put a few little tiny sort of in a rounded off over the top like this, so that you don't see the stitch. There's a little tiny stitch end, and that's it. And then essentially, then we get patients out of theatre downstairs so that we can go through the aftercare. We're in Yorkshire, so everyone's forced to have a brew, regardless of whether they want one or not, because that's just what you do in Yorkshire. Everyone has to have a cup of tea or a brew.
You don't do that. You only drink coffee.
I don't, yeah, but that's the joys of working in Yorkshire. That's how you know someone's well, if you can give them a brew. But yeah, we just usually give them a coffee or a tea, and a biscuit or something, making sure they're okay. And then what happens is the nurses go downstairs and go through the aftercare. I used to start going through the aftercare, but the nurses hated the fact that I was interjecting, so they tend to sit them down, go through everything, and then give them the discharge instructions afterwards, and then numbers if there are any problems. The clinic number and an on-call number for any problems.
And you would run through the risks and all of that in the consultation, so they know all that.
Yeah, so what I tend to do with the risks is I tend to go to what to expect over the next few months, which then kind of includes the risks as well. And then what we also do is we send them out a consent form electronically beforehand, so they can read through everything.
Yeah.
And then obviously we've then got information on a website as well. But what I tend to do is go through what to expect, and then all the kind of risks kind of make sense. So realistically, aftercare wise, when they leave the building, usually they're feeling a little bit of a sting. It's starting to throb a bit, but it's not usually too bad. Paracetamol only. I wouldn't expect anybody to need anything more than paracetamol. And I'll go on to actually why that's relevant of one of the risks later on. What then tends to happen bruising wise? So bruising is more of a consequence than a risk. So we talk about bruising usually with types of surgery, but 99.9% of people are going to get some form of bruising. So it's a consequence rather than a complication. So usually when they leave the clinic, they have a little bit of spotting on their steri strips, meaning they can often see a little bit where there is a little bit of blood. Now, that sounds quite dramatic. It's not. But obviously you can't put big bulky bandages on people's faces. So the steri strips work very, very well, but they're not going to stay clean and pristine white for that week. It's just not going to happen. So normally you get a little bit of spotting. Some patients leave with a bit of bruising just from where the local anaesthetic has gone in. Most patients, not too bad. A little bit puffy just from the local, but not too bruised at all. And then what tends to happen is over the next few hours, the actual lids, so below where the steri strips are, that gets a bit pinky purple and can often look a bit like an allergy. So say patients worry a little bit. And if they do, that's why clinics like ours have an on-call number. You can send a picture through, just, is it okay? But that's normally what happens. And then gravitationally wise, it tends to go down onto the lower lid. Now, people on the internet tend to share their journeys. And usually with anything in life, people share the extremes, whether that be a hotel review or a restaurant review, either really, really unhappy or really, really happy. And with regards to sort of bruising and bits and pieces like that, you either get the extremes that are shared or the ones that have no bruising and no swelling, and they've come out of Coppergate after a week and go, look, look at this, it's amazing. But for the average patient, that doesn't tend to happen. So normally it's quite bruised for 48 hours. And it tends to, on day 3, day 4, the bruising starts to improve and flatten off and start to go that sort of goldenly colour. And normally at that point is where the steri strips start to get a little bit itchy. And unfortunately, it's not a great deal you can do about that, but they do get a little bit itchy. Now, normally at a week, steri strips come off and the stitches come out. And I always say to patients, it's not grand reveal surgery. It's not like you expect on the TV and they take all the crepe bandages off and it's a new person underneath. You have to bear in mind it's only a week post-op. You have not been able to wash your face properly. It's all a bit dry. But from a bruising point of view, most people are still a goldeny purple colour on their lower lid. And it takes about 10 days to 2 weeks to start to look what we call socially acceptable, meaning a lot of the swelling is settling down and that bruising tends to have gone. But that being said, some people just still get a little bit of annoying bruise, that can last 2 to 3 weeks. It's rare, but it can happen. And so not everyone is equal with that. Swelling wise, usually when the steri strips come off as well, it can be really quite puffy above where the steri strips have been and the skin can look quite dry. So probably a good 50% of our patients look worse than they had it beforehand. And so patients can be quite disheartened, and we say, please don't be disheartened. It's at least 2 weeks to look socially acceptable, but it's a good 3 months or so to get your final results.
Oh my gosh, wow.
Other things you have to tell people about, though, infection. And infection is very, very rare. We normally quote figures about 1% or so, but it's incredibly rare to ever give out antibiotics because there's no internal stitches and the blood supply, as I've just alluded to, is very, very good. So it is incredibly rare. But what's not uncommon, and I tell people so they don't worry, is when the steri strips and stitch come off, you can see a little bobble in the corner and it almost looks like a spot, but it's not. It's just where the stitch ends has been. So I always tell patients that, again, as a consequence, it might happen, but if you look in the mirror and see it, don't panic. It will go within 24, 48 hours or so. And other things to tell people about, the lids sometimes get a bit numb. And in fact, sometimes people say when they put on mascara, it can feel a bit funny. That tends to happen for at most 3 to maybe 6 months. I used to say 3 months, but I've had the odd patient that's lasted a little bit longer. But it's a bit like if you had a scar on anywhere else on the body, it feels a bit weird around the outside. But people tend to not expect that with a lid. And it's the same thing as a scar anywhere else. It can just feel a bit weird to start off with. And
Yes.
we like you to moisturize and massage your scars. So certainly it will feel a bit weird when you first start doing it.
So you're going on to aftercare here. What kind of things would you recommend for aftercare? I mean, I've heard getting peas and frozen peas and putting them on. I've heard massaging them with these special expensive creams. Like, what should people be doing?
Yeah, so we like to keep things relatively simple. So
Yeah.
if you can sleep up on a few pillows, great. It will almost certainly help with the bruising and the swelling. But I would rather people sleep. I've always slept on my left-hand side and always will, and I don't think I could sleep on my back. So I would much rather someone goes to sleep than is sat bolt upright at 4 in the morning not sleeping, because that's almost
Yeah.
certainly going to be worse for them. But if they can,
Yeah.
absolutely great. I don't like ice, realistically, for a couple of reasons. Firstly, we've put steri strips on. We want the steri strips to stay on. And
Yes.
so anything like that around it has the chance of, making it wet, damp, and falling off.
Yes.
And
Yeah.
although
Yeah.
having showers is fine, as long as you pat the steri strips off, we don't want them saturated, but ice can easily make it come off.
Yeah. So the same with frozen peas. You wouldn't sit with frozen peas on your.
No, not at all. And then there's other things, blepharoplasty shields. I think you can get on Amazon and things,
Yeah.
but
Yeah.
actually, I think you've got more chance of disturbing things. So really, what you want to do is just taking it very gently. Some of our patients use arnica tablets a few weeks
Yes.
beforehand. There's certainly no harm for it. I
Yeah.
don't know if there's a great deal of evidence for it. Anecdotally, I would say the patients that have arnica tablets seem to do a little bit better.
Oh,
However, again, they are in a self-selecting group, because if they're the kind of patients that are going to start to take arnica tablets, they're probably also the kind of patients that are going to take it very easily and,
yeah.
be gentle and not do some of the silly
Yeah.
things that might result in bruising. Probably it is a benefit, but I'm not sure. But it's just taking it really gently for that first week or so to try and minimize the amount of swelling and bruising that you get realistically.
When can you drive?
So I tend to say at a minimum a week. As far as I'm aware, there's no DVLA or car insurance guidelines, but I kind of always joke to patients and say, we do live in a suing culture. And if you have a car crash and you get out of your car and you've got steri strips on your eyelids, it's not going to be a great look. And I
No.
don't think you're ever going to find any expert in the country that says you are safe to drive. So I normally
Yeah.
say to patients a week. If at a week it's bruised and it's really swollen, then
Yeah.
no. But most patients at a week are absolutely fine. So that kind of goes in a little bit hand with work, because we're often asked about work.
Yeah.
Now, we obviously operate a lot of people in the beauty industry and people who are self-employed. How long to take off work depends on what work you do and what you want people to know about. So
Yes.
at the minimum, I say to take a couple of days off. Even if you're self-employed, even if you're not bothered about what people are going to say, and you don't drive, because you're bound to feel quite tired the next day, just purely from the fact you've had surgery done, you get an adrenaline response, you're going to feel tired. And even people working from home, I don't underestimate how tiring it is sat on a screen all day. So, I would at the very minimum take a couple of days off if you can a week. Obviously, I said early on, socially acceptable, 10 days to 2 weeks. So if you don't want anybody to know anything about it, then it could be a couple of weeks, for instance.
Yes. I mean, if you are one of those patients that are bruised,
Yeah.
and you wouldn't know that really, then you should allow maybe 2 weeks.
Yeah, well, I had an air stewardess a couple of years ago who said, I cannot let anyone know at all. I
No.
don't want to be
Yeah.
bruised. And I said, well, then you could be talking 3 weeks or so. I
Yeah. It
can't predict
depends.
it, but
Yeah.
it would be sod's law, wouldn't it? But that you need to get back to work and you ought to be that kind of person. And
Yes.
so what I also say to people as well, along the same line, is don't book anything that's important to you within 6 weeks, because most patients at 6 weeks are settling. But if you've got a wedding or an event or a birthday or something that's important to you, what you
Yeah.
don't want to be doing is counting down and saying, well, James said it was going to be 2 weeks till it's socially acceptable, and I'm 11 days, and now I'm 10 days, and now I'm 9 days. So just make sure that even though with this kind of surgery, it's relatively low downtime, you just book it at the time in your life that's, not going to be too confusing with work and holidays and all those kind of things. Just
Events.
get it at the suitable time for you. And holidays as well, I always say 6 weeks. And realistically, that's not about flying, because technically you could fly the next day, when you look at anesthetic guidelines. But there's a few reasons. Number one is, if you have any problem, we want you to be in the country that's operated on you. So, for the very minimum 2 weeks. But also, lids are very sensitive structures. And so you don't want to be doing anything that makes you hot and red in the face. And that includes hot climates and gym and saunas and spin classes and all those kind of things. So you just, again, want to make sure that it's done at the right point for you. All right. So you're not mixing it in. So holidays are important.
Can we go back to how the stitches come out?
Yeah, so it's a running stitch, and so realistically, it's, you take the steri strips off. So some of our patients take them out themselves. Some of them we do it, and that feels like a trick. Saying it doesn't affect us if patients come to us or do it themselves. It's absolutely fine either way. It doesn't affect us. But usually we're trying to make it more easy for patients. But realistically, the steri strips come off and the stitch can get pulled out. And because it's a running stitch that goes under the skin, it's very, very easy to do. Very simple. It takes 10 or 20 seconds or so. So some patients, it might save them a 5-hour round trip for something that takes 20, 30 seconds. But
And
we
you can
always
do it online with them.
Yeah, do the video call.
Yes, that's what
and we
do.
make sure that it's safe. And worst comes to worst, they have to come the next day. If someone bottles it, I've never had that happen. But we do make sure that consultations, that people are aware about that. But realistically, as I said, it's a running stitch. And then at that point, at that 1 week point, they don't really need to do a great deal. Still need to just be very gentle with it. And although the wound is healed, it's still very delicate. So what we tend to do is wait another week before they start doing anything. So happy to wash your face, but I say to patients, don't use a flannel and do this, because it's still very delicate. And so bear in mind for the next week afterwards, if you had a trauma, if you were knocked, technically the wound could open up. So you just need to be careful. So don't put yourself in a scenario where that could happen. And then what we normally say is at 2 weeks, that's when we want you to start moisturizing and massaging. And you mentioned earlier on about what lotions and potions and creams to use. It doesn't need to be anything too fancy. When you're doing tummy surgery or breast surgery or things like that, then or you're prone to bad scars, then the silicons, the bio-oils, those kind of bits and pieces are good. But actually, eyelids, they're sensitive structures. And people who have sensitivities sometimes just have it in their eyelids. So I would prefer patients use something that they normally use, that's relatively simple. And at the very minimum, something like Vaseline is fine. I know people don't want to go out and about with Vaseline on, but at night time, Vaseline is okay. It's not too bad. But a moisturizer that's safe around their eyelid that they normally use, it's more to do with the massage than anything else. And so what we get them to do is massage from the inside out, which helps to improve the scar, but also helps with a bit of the swelling as things are settling down. And so normally at 6 weeks, most patients' scars are doing okay. You can have a few little lumpy, bumpy bits just as it's scarring, which sounds dramatic, but not something that you'd necessarily see at a conversational distance. And so if you continue that up to about 3 months, most of the time it's a barely visible scar. Certainly nothing that you'd see at a conversational distance. But, with your eyes closed and stretched out, you can still see it. But compared to scars on other parts of the body that take up to 18 months of scars, it does heal very, very nicely, and does scar very nicely.
No, that's I think a lot of people don't realise, the whole of this impact. So I think it's great to go through all of this. I was going to say, so how do you go about like finding a surgeon to do this sort of procedure? Who should you look for?
So realistically, there's some sort of prerequisites which we think any patients should go for. Ideally, recommendation. If you know someone that's gone somewhere, that's a great thing. But what you're wanting to look for is either an ophthalmology surgeon or a plastic surgeon that it's part of their subspecialty. Someone that's GMC registered, that's on the specialist register. and then ideally affiliated with, another group such as a BARPS or a BAPRAS, but something that's demonstrating their commitment to their specialty as much as anything else.
So can you explain to everybody that doesn't know, what is a GMC number?
So GMC number is a number allocated to any medical doctor in the UK once they've demonstrated they've completed a training, which may be in this country or in another country. Whereas the specialist register is an additional section which demonstrates that they've met competency, that they could be an honorary or substantive consultant in the NHS. So normally for a UK trained surgeon, for example, they've gone through the normal UK training program and completed, in our country, it's called the FRCS. So it's an FRCS in plastics. But for other people that are, coming over, there's other like European EBOPRAS, etc. But it's kind of a standard known that you've met that.
And so how can you find if someone has got this? What do you do?
Well, so the easiest way, actually, GMC is relatively easy. Probably not when you've got the name James Smith, but actually, if you go to the GMC website, you can do search the register, and so if you look up their name, or also known as, if you've got their GMC number, and hopefully,
I think on the website, your website.
yeah, so hopefully most websites, that people are advertising would have it on, and if you're Aspire or Bupa, etc., that would be very, very easy to get, and so you just put the number in and have a look, and then you can find out, if they're registered, if they're on the specialist register, and anything else that's come up, so it's those kind of things you're looking for, really.
And so it would say underneath that they are on the specialist register on that.
Yes,
GMC
what it tends
website.
to say is, it says their name, what they qualified and where they qualified, and then it'll be when they were put on the register, and then normally if they're on the specialist register, and then who's responsible for them, because essentially as part of NHS or private, we have to be appraised. So every year we have to have an appraisal process. And there's something called GMC revalidation, which you have to go through as well. So it says who your responsible officer is. So you might see that it's an affiliation with, Aspire, for example, or it might be, like for me, an association with Leeds Teaching Hospital Trust. So that's who you'd see on that.
Okay, that's interesting. I think a lot of people just don't know how to search for surgeons or what to do. So I think that's really important, for them to realise that there is this available, and then they can actually look it up.
Yeah.
So are there any common misconceptions about having an upper blepharoplasty?
I guess the thing that we kind of reiterate to patients is it has got one of the highest satisfactions of any plastic surgery we do, with the lowest downtime compared to anything else. So the recovery is much quicker, albeit I mentioned sort of 3 months ish to get your final results. So it is much quicker. But what I kind of tend to say to patients, it is right in the middle of your face. So it does have the highest expectations very, very early on. Understandably, it's a bit like if you have a spot on your face, you think everyone can see it. And, most people can't, but it is right in the middle of your face. And I tend to say to patients as well, if you have breast surgery and, you've got a little bump on your scar, you go, it's fine. It's getting better. No one's seeing it. You're not looking every day. But everyone is looking in the mirror at least twice a day. So you've got to bear in mind not only how you're going to perceive yourself afterwards and how others are going to perceive you, but also bearing in mind those high expectations that you might have when it's on the middle of your face. And then the other thing to say is, what's it going to look like afterwards? Everyone is very, very different. So lots of patients ask for before and afters, which is fine if we've got before and afters, but they're not always comparable. Some patients have quite heavy lids who are what I could describe quite edematous, meaning it's almost a bit swollen. Some people have very, very thin skin and it's just excess hooding. Some people have lower brows. Some people have eyebrows. Some people have asymmetry. In fact, most people have asymmetry.
That's
So
interesting.
pointing out those kind of things.
Yeah. Okay. That's it. So the main point is everybody is different, and you cannot compare one person to another person.
Yeah, it's very difficult. You know, we live in an interesting age now when obviously expectations are through the roof, and you know, I think results are very, very good. But people are always comparing themselves to the Instagram, to this, to that, and you know,
Yes.
although as I said, hopefully, you know, we work in a clinic that's got a great reputation, has got great reviews on Trustpilot,
Yeah.
and we get very good results, and people are happy, but it's very difficult to say to patients, this is exactly what you're going to look like compared to everybody else.
Mm.
And so we try and provide people with reassurance, but it's difficult to do that in anything. You know, it really
Yeah.
is.
I mean, I've seen some amazing results, poor ladies that can't actually see anything. And, now they can see. I
Yeah,
think it
yeah.
can transform people
Yeah,
and they not just like from the outside, but inside too, and give
yeah.
them a lot more confidence.
I tried to use an analogy the other day to try and describe what a blepharoplasty is and how people are different. And Nick, who I work with, loves analogies, and actually they're really good for patients. People ask, well, why the results, or why can the results be slightly different? And it's kind of, you know, if you got the best builder in that you've ever had, fantastic builder, and you said you want to build a house. But you're providing the equipment to build the house, and you're telling them exactly where they're going to build it and what part of the world you're going to build it on. So, you know, it can be the best builder known to the world, but it's all those variables that they're necessarily going to have to deal with. You're looking at me like that analogy doesn't work, but that's how
No, I
trying
know, I
to
understand.
describe to people that
Yeah,
why
no, I get
somebody's
it.
different, that's
Yeah,
variables that sometimes outside of
yeah,
your control,
yeah.
realistically.
No, I mean, and you do notice so many things on people's faces. You're very observant with, how people look and what happens. And I definitely notice, like when you've done an upper blepharoplasty on somebody, the difference is amazing. It's really
Yeah,
good.
it can be. Yeah.
Yeah, yeah, yeah,
Yeah.
yeah. So, what advice would you give to somebody that's considering having this for the first time?
So you know, research,
Yeah,
have a look on. Certainly, you know, we've got the Coppergate website where you can have a look. There's some before and afters. We've got social media. BARP's website, I think, is very good at going through lots of different cosmetic surgery. There are lots of different forums which have some pros and cons. You've got to be a little bit careful
yeah,
sometimes on them, but I think they're useful at providing some of the information. But you just want to make sure that you've talked to it. And then try and talk to other people, or if you're going to a beauty clinic, for instance, you're talking about Botox, maybe getting their advice about do they know anyone that's had it, because it is one of those surgeries that much more people have had it than people
yeah.
realize, because they often sneak off and have it, and then people go, oh, you look well, what have you,
You want,
especially off the back of
yeah,
COVID, when people were still working from home, and then when they finally came into the office, they looked 10 years younger, and it
yeah.
turned out they'd had their lids done and a facelift done, and no one knew. So,
I so
yeah.
need mine doing. Oh, so I was going to say, have you got any memorable patients that you can sort of share their highlights? Like, how has it changed their life?
Uh, yeah, we have quite a lot of
Look, yeah,
memorable patients that
no,
it changes their life.
but as
There's
in,
a lot of
with,
lovely patients where they say this is the best thing that I've ever had done, which is lovely for something that's relatively simple. I did have a lady last year that had quite a lot of eczema on her lids,
yeah,
and we did and ah about whether we should be doing it, because it is a little bit risky, because you think, well, thin skin already, she'd had
yeah,
some hydrocortisone in the past, but it felt really like it was a rubbing issue, and we did the blepharoplasty because she had quite a lot of excess skin anyway. And actually, even though I didn't say it would necessarily get rid of it, it completely sorted out her eczema and completely got rid of it. So it has really
amazing.
revolutionized things for her, and she's had
Well,
nice results. In the same way, you could be potentially criticized for that because it's a difficult one to do, but it was she's an incredibly sensible patient. Had done her research beforehand, so we made a very good plan about what we were doing. So yeah, it was lovely. It's nice. It means that she doesn't have to use steroids, hopefully, on her lids again, which is fantastic given the suffering patients can have on steroids in the
yeah,
face.
yeah.
Yeah.
And so, how can people find you if they want to find out more information about this? Where would they go?
So I think I'm on most social media platforms.
Yeah,
I've got my Instagram, I've got
yes,
my TikTok, which I think
yes.
we're waiting for me to be doing dancing on.
You're not going to do that.
I think I'm on LinkedIn. I have a website.
Yes.
And then Coppergate has a great website with all the different types of surgery that are performed there, all the surgeons that work there as well, and then all the other alternative treatments. And then Coppergate, Instagram, Facebook, and TikTok.
Yes. I think they're on every sort of platform, aren't they?
But if people are interested, the easiest thing is have a look on there. As I said, have a look on the BARP's website as well, because they'll go through things like blepharoplasty. And then if people were interested in consultation, there's a few links on the social media on the website. So either email in or phone through, and they can book for a consultation. Some people send photos in to see, am I a good candidate? We try and give as much advice as we can, but it's sometimes difficult on a one-off photo. But if not, phone through to the clinic and they can make a booking.
Okay, that's great. Thank you. I think that is everything I was going to ask. I'm just checking. If there's anything else, I'm sure we can come back and do another one of these. Thank you very much. That was very interesting, and I'm hoping everybody else found that really insightful.
Absolute pleasure.
Thank you. Until next time. Bye-bye.